Hello, everyone. Welcome back to this week's episode of Mocktail Minutes. This is Bailey.
And this is Brianna.
This week, I am drinking a Sun Sip. I've never seen these before, but it's basically another prebiotic soda drink. It's a strawberry vanilla. It tastes really good. A lot of the ingredients, it's mainly like juices at the beginning. So it's about 7 grams of carbs, and then it's sweetened with some cane sugar and monk fruit, but not terrible. Tastes pretty good.
It does, yeah. I'm doing the strawberry lemon poppy. I got a Costco pack, so this is one that's in there. Do you guys have an HTO where you live?
No.
Like a drive-through like tea place. They started, I feel like there are other places, I don't know, but if you're in the Texas area, they started doing poppy drinks. Well, they'll like mix a poppy with like one of their green teas and add like cucumber and some other flavor. They're actually so good.
Oh, that
I'm
does sound good.
pretty sure that their pumps of stuff have regular sugar in it. So I just always ask for half, but I've been meaning to go on their website and see like does it, but
Hmm.
they're so good. It's actually becoming a problem.
No, we don't have any cool places like that. We just have coffee shops everywhere. A lot of them do have like the Lotus drinks now, but
Mhm. We're supposed to be getting one of those like soda
like the
things.
Swigs.
Yeah, like that are really popular in Utah, you know?
Hmm.
Yeah. Ever since like the
Watch that
moon
show.
talk or yeah, ever since that came out, like New Braunfels was like, we're getting one. And I was like, of course.
Yeah, I know. Now everyone's like in the dirty soda and everything. Like, oh,
Yeah.
no, this is the best trend to hop on.
Right. I'm like, okay, well, here we go.
Yeah.
But
But if you mix your poppy with like vanilla protein, that's another
mm,
story. Like the root beer one, I've mixed that with the vanilla protein before. It tastes like your
oh,
like root beer float.
that does sound really good. I've been meaning to do that, like mix like the root beer poppy or even the Olipop with like one of like a vanilla protein. Like,
Yeah.
the viral like Diet Coke one was going around.
Yep.
I was gonna try that, but
Yeah, it was really good. I thoroughly enjoyed it.
I'm gonna do it next week if I remember.
A dirty soda with benefits.
A dirty beneficial soda.
Yes.
Love it.
Well, today we are talking about type 3 diabetes. So this actually is not like official diagnosis yet. Information is still surfacing about type 3 diabetes, but there has been research studies suggesting that Alzheimer's disease should also be classified as a type of diabetes, which is now being referred to as like the type 3. But it's just not an official medical term yet.
Mhm.
So with this, we're basically seeing that insulin resistance and insulin like growth factor dysfunction in the brain may cause Alzheimer's disease, which is a pretty significant discovery. I mean, it's literally so many things come back to blood sugar balancing. That's why that's another thing I feel like we talk about all the time because so many
Mhm.
things go back to it. I was just doing a training yesterday over our cholesterol, and the whole time, like they're talking about decreasing fats, decreasing fat, decreasing fat, saturated fat, saturated fat. But then they every time they would come back to, but it also relates to sugar intake. And I'm like,
So is it the fat
why, why
or
are we missing this connection?
yeah.
So there are literally so many different chronic diseases and so many like inflammatory things that go on with the body that all has to do with sugar most of the time.
Mhm.
And so I think, yeah, type 3 diabetes is definitely a significant one that we're going to be hearing more about. I
Yeah.
mean, I would say even this year, I think we're going to learn more about it. Most people know about type 1 and type 2, where type 1 is like your autoimmune type of diabetes. Your
Mhm.
body is not producing that insulin anymore. This is when you have to take insulin. It's your body's pancreas is just not producing it, and your blood sugar levels become too high because you don't have anything to shuffle it into your cells. And then
Yeah.
we have type 2 diabetes when your body develops insulin resistance, causing, again, your blood sugar levels to become too high. Well, I guess there's gestational diabetes too. So that's when pregnancy, if your body cannot produce the insulin it needs, your blood sugar levels become too high. So we have like type 1 and type 2 gestational, and now we're seeing more information coming for type 3 diabetes.
I'm also seeing, because this is what I've been seeing doctors use regularly, and I don't know if it's just the providers in my area, but like type 1.5 or like 1.5. It's basically you have type 2 diabetes, but now you take insulin for it. So again, yeah, like Bailey said, it's not like considered a disease. Like no one is saying, oh, type 3 diabetes. But I do think in the next couple of years, we're going to see a lot more, especially with all of the GLP-1 microdosing research that's being done and how we're seeing like just insulin impacts the brain. So some research are really like there's people who are dedicated to just this because we don't have a cure for Alzheimer's. And so obviously finding something that helps to prevent it or at least prevent the progression of it is really, really popular. And so all the researchers or a big majority of them are just looking at the role of insulin and how blood sugar and insulin is impacting the progression of that disease. And they're finding that the hyperinsulinemia really does impact it, mostly because what is that like alpha thing or the AP aggregation? Oh, the amyloid B protein. So apparently that is what's looked at as like building up plaque in the brain, and increased serum insulin is increasing also increases that. So it's just linked like, okay, if we can control the insulin, do we slow down that? And we are seeing that. So I think it's interesting. But yeah, definitely thinking just in terms of like our brain needing glucose. And if our brain can't utilize glucose, what is happening? You know?
Yeah, it's really hard for your body to run off what it doesn't prefer.
Yeah.
And and this is where we need carbs. We definitely need carbs. We've talked about this in previous episodes. That is our body's number one preferred fuel source. So insulin does play key roles in allowing your brain cells to absorb and use this glucose efficiently.
Mm.
Insulin also has neuroprotective effects. I know we we talk bad about insulin. He's the bad guy.
Honestly,
But
oh my gosh, I was just this morning, I haven't finished it. Maybe I'll link it with the show notes, but there, Dr. Tina Moore had someone on her podcast talking specifically about this and like the different roles of insulin and why we like need it. And it is so, so, so protective. But the issue is like when your brain stops listening to the signaling, and then all of the things that your body does to try to protect itself from excess insulin, that is like the issue. So it is,
mhm,
you need it. Like you would die. If you did not have
yeah,
insulin, you die.
yeah,
You have it.
that's where maybe we should do a better job of being devil's advocate here, but because we talk about insulin as like the fat storing hormone, or we don't want all this insulin in our bloodstream, which you don't. You don't want insulin just hanging out in your bloodstream in this abundant amount all day long because it can also enhance memory, reduce inflammation, and prevent the buildup of the beta amyloid plaques too.
Mhm.
So it's just like with anything, too much of it is a bad thing, but we also need it to kind of keep our life going. So with this type 3 diabetes, and your brain cells become insulin resistant, which is what leads to decreased glucose metabolism in your brain, increased oxidative stress, the accumulation of the amyloid plaques, and neuronal death and cognitive decline.
Mhm.
So we're definitely seeing that people with type 2 diabetes have a higher risk of developing Alzheimer's due to that systemic insulin resistance. So, insulin resistance all around.
Mhm.
So, there's lots of things that we can kind of do to mitigate this. This is another thing you're not doomed for.
Right.
So, it'd be really cool if we could almost like stop Alzheimer's in its track,
100%. It's a
especially
horrible disease.
blood sugar balancing. Oh my gosh. Like, we can absolutely do that.
I know. And I like nerd out when I listen to podcasts on this and stuff. I'm like, yes, like this is making what we do makes a difference. Like so
Yes.
excited about it, like it's
You
so,
get that like dietitian high of I'm literally about to change the world. How
yeah.
am I going to do that? How am I going to let everyone know this is how you're going to change your life and make them believe it too?
Right, exactly. That's the part. Like make them believe it and make them just excited as you are, which I get. Some people aren't excited, but when you really dig into just how important your metabolic health is just for everything. And I think we only think about it in terms of like maintaining a healthy weight, but like insulin is linked to all parts of your metabolic health, your cognitive health, your cardiovascular health, your endocrine health. Like it's very important. And I think a good way to look at it is like insulin is a signaler. Okay. So it is basically telling cells what to do. It's telling cells like pick up this glucose or ignore this, or like that's what it's doing because it is a storage hormone, but your cells have to be able to listen to it. And so what's happening is your cells just aren't able to listen to it anymore. So your body's creating more and more insulin. Okay, it needs to hear me. It needs to hear me. And that buildup of the insulin is like, what is the problem? Because it's not your cells and it's not talking. And people get very confused about insulin resistance and insulin sensitivity. You want to have good insulin sensitivity. You don't want to be insulin resistant. I know that's like kind of confusing, but you know,
Think
basically,
about it as like your emotions. Like if you are emotionally sensitive, you're you're going to feel a lot more, you're going to react a lot more. If you're
yeah,
emotionally resistant, you kind of block it all out.
yeah,
So, in this case, we want to be more sensitive.
yeah. We want to be more sensitive. We want to be able to listen to it easily. A little bit goes a long way, that sort of thing. Because again, insulin is very protective when it's signaling your cells correctly and your cells are hearing it correctly. But some of the risk factors for type 3 diabetes obviously is going to be things that we talk about a lot, but obviously type 2 diabetes increases your risk just because you already have that insulin resistance going on in other parts of your body. Obesity, excess of body fat does contribute to insulin resistance and inflammation, which the podcast that I'm referring to does a really good job at breaking this down. It's like some biology, doctor of biology, whatever. It's so interesting because I've never heard it the way he describes it. He also goes down a rabbit hole as to why once this happens and your fat cells are already to a certain size, the calorie deficit is a little bit null,
Mhm.
which we see that, right? But whatever, I'm not going to go down that rabbit hole right now. But the other things, high sugar diets, and not so much of like the high quality carbs, but just those highly processed, sugars, the unhealthy fats, a lot of your highly processed foods, that sort of thing worsens insulin resistance, lack of exercise, or just being sedentary. And then chronic inflammation, which there are, especially as we age, a lot of conditions that contribute to chronic systemic inflammation, which leads to a higher probability of getting these diseases, which also increase inflammation. And then after a while, you're just like this chronic ball of inflammation and it's really hard to get
Yeah,
out from underneath. Yeah.
a walking ball of fire that it's usually the people too. It's like you've tried for so long to lose weight, and it's like, what is anything going to work for me?
Yeah.
And it goes either two ways. We either keep pushing ourselves and now we get more inflamed, or we get into the effort mode and like, it doesn't matter. Nothing matters anymore. So inflammation's rough, man.
Yeah. And so if you're just thinking like, if you're one of those people and you're just thinking calories in, calories out, I need to work out more, I would say think of it a little bit different and start thinking like, how can it be more insulin sensitive? So everything we just talked about putting you at risk, what is the opposite of being sedentary? What's the opposite of a highly processed
Yeah.
diet? That sort of thing.
So, in order to really work to prevent or even manage type 3 diabetes, you
Mhm.
have to focus on your diet and nutrition. Diet, not as in like your dieting, diet as in,
Like what you eat, the quality of what you eat. Yeah.
yes. So, you want to really focus on this blood sugar balancing. I don't think we can emphasize this enough. And I mean, it's not anything you're going to master after this episode. It takes a little check and guess, not check and guess, play and plug maybe. Play and plug,
Yeah.
see what works for you and kind of understanding what does blood sugar balancing mean. But essentially it's you're not eating carbs alone. You're balancing it out with fat and protein. You're eating high fiber carbs. So there's a lot of pieces that go into it, but carbs aren't necessarily the problem with blood sugar. It's more, how are we eating them? What are we eating them with?
Hmm.
Should we eat Fruity Pebbles every morning? No, probably not. That's not really giving you any benefits. But, Fruity Pebbles mixed with some like high protein, like if you mix like a protein shake up and dump it in there for your milk with some chia seeds on it, that's going to go a lot better than
Yeah.
just the Fruity Pebbles alone. So, thinking about how you can balance out your meals, including omega-3s for healthy fats, is going to help your brain health. Even focusing on more of a Mediterranean diet. So include fish, include your omega-3s and antioxidant rich foods, your fruits and vegetables. I think that's one of the best quote unquote diets out there is
Hmm.
a Mediterranean one, but not something that you need to be like super strict about.
Hmm.
Now, there's also intermittent fasting. So, intermittent fasting, I kind of say with a little bit of hesitation because
Yes.
if you, honestly, if you're on a weight loss journey and you've been working to lose weight for a while, intermittent fasting is probably not for you.
You're probably doing it.
Yeah, you're probably doing it, you've done it, your body's already stressed. Intermittent fasting is really meant to be more of a good stressor on your body. Your body's already stressed out. We don't want to add this
Hmm.
stressor. That's going to cause more insulin and glucose issues. But if you are in good metabolic health, you're in good metabolic shape, intermittent fasting can help improve insulin sensitivity and help your brain cells repair.
Hmm.
So this is actually I've kind of started doing once on the weekends. So like Saturday, Sunday, I'll do like a 16-hour fast when I'm feeling good.
Hmm.
It doesn't always happen, but it's like, oh, I've had a pretty good week. I've kind of kept up with everything, give my body a little bit of challenge. But if I know I've been a little bit everywhere and my head's not screwed on right, we've missed a meal, it's like you know when your body feels
Yeah.
stressed, then I don't do it.
Yeah. Well, because a little caveat about intermittent fasting is yes, okay, it's supposed to help stress, like you're saying. But if you are under eating, that is a huge stressor on the body. So there's a very big difference between like I've been adequately eating calories and now I'm going to go a longer window of time of not introducing food. And most people trying to lose weight just aren't there. They're not because they've been in like a major calorie deficit or they're not eating very well as it is. And so it's not the same. It's not
Mhm.
the same. And intermittent fasting is you're still meant to eat an adequate amount of calories when you go back into your eating window, which is what people aren't doing. And then if you hear about it on the internet, it's like intermittent fasting works because it reduces calorie intake. I'm like, well, that's not the point of
That's
intermittent
not the point of this.
fasting. Not the point at all. So if you are one of those people and you're like, well, I'm not there yet, we do talk about like the overnight 12-hour fast. That's still good. Or getting adequate sleep, because a lot of the stuff that you see go on when you do intermittent fasting correctly, you can see it with like a good night quality sleep. So if you're like,
Hmm.
I'm not ready to do that, okay, double down on sleep. But yeah,
Yeah.
don't hear intermittent fasting and be like, ooh, we can eat one meal a day because my brain health.
No, that's
400
not
calorie meal a
what
day for my
we're
brain.
saying.
People are just doing it wrong. And I'm sure the creators of intermittent fasting and all the people who research it are probably like so annoyed with the internet and the internet's version of intermittent fasting. So yeah, it's different. Physical activity. I mean, this is for everyone, right? And I think the biggest thing to take from this is to start doing these things before you are at risk of disease or before you have a disease. I think I can't get that through people enough. I think we just feel really like indestructible, right? You're like in your 20s, you're doing whatever you want, especially early 20s. And then for men, especially, I see this like they don't really worry about their health until, oh my gosh, now I have to, right? Oh, now there's an issue. So knowing like how you treat your body your whole life really does impact what it does later on. And yeah, obviously there's sometimes genetic factors that play into like why you have a higher risk for something, but taking care of all these things before there's an issue is really important. So obviously nutrition, but then physical exercise. So like aerobic exercise, like that's your cardio, walking, jogging, swimming, all of that improves insulin sensitivity because you're moving your body and it's good for cardiovascular health, but then also strength training. So that is really like building muscle and enhancing glucose metabolism because the more muscle you have, the more area or places you have glucose to go, that's not your fat cells. So, in terms of like that, the goal is just to never eat carbs or glucose again. It's to have good places for it to go. And the more muscle you have, the more places you have for it to go. So, strength training is going to be good for everything. And then brain exercises can just help, cognitive activities, puzzles, learning new skills, Sudoku, reading, just, basically like working out your brain,
Mhm.
using it.
Yes.
Yeah.
And then other things that are going to help, like I would say do these things first. We already mentioned blood sugar balancing. That's going to be number one. Blood sugar balancing, sleep, movement, decreasing stress. These
Yeah.
things are going to make a big difference. And this is where too, like we get so focused on what's the next big thing that I can do? What is this big answer that I need? Sometimes you just need to go to bed and put your phone away.
Yeah.
And we as humans, if I were to tell you I had a drink that would allow you to hit like the factory reset button and it was $150, you would probably buy it, but
Yeah.
you wouldn't schedule a session to learn how to hit your own factory reset button
We don't want
to learn
to.
about your body.
Hmm.
I don't know, it's like I can't quite figure it out where we have gone wrong in everyone's brains. It's not just, I mean, we're all like this in certain areas where it's like I could wash my face or I could get a facial every day. I like not every day, maybe more every month, but you know what I mean?
Right.
Or yeah, it's like all these different things. Like I could do this and do this small thing every day, or I could just pay like $300 and do that once a
Have it
month. And I'm
all
like,
work on its
yeah,
own, and then I don't need to change anything.
we're st- why are we scared to put in the work?
I don't know. And we obviously have this conversation a lot because a huge part of our job is like motivational interviewing, right? Like
Yeah,
getting people to come to the conclusion that they want to make lifestyle changes. I don't know. You know what I think a big part of it is instant gratification. I think we are
yeah,
just not used to like, oh, you have to be patient and put in work to have an outcome. I mean, it's Amazon.
yeah.
It's Netflix.
And
Like
I
my
think
kids are like, what are commercials? Fast forward to it. Like we were in a hotel the other weekend and they were like, what is this? Fast forward it. What
you're
skip
like,
the ad. They're like, skip the ad. And I was like, this is a commercial. You're gonna have to wait like a minute and a half.
yeah. And I think, you know what? I think it is honestly, our brains are programmed to fear change. We like consistency. And so it's like things, especially that have been engraved in our heads since childhood, it's going to be so hard to change it.
Yeah.
Habits are really hard to form. So it's just about you got to find that consistency. You got to keep going. You got to find your own reasoning why. You got to be really realistic with yourself. And a lot of this that helps is when you get to learn about your body. You have to break down this barrier of I can't or I don't want to. You have to find what matters to you. And that's a big piece of it.
Right. And that's why I was saying, like, worrying about this stuff earlier on. I don't think it matters to most people when it's just not in your face, right? Like, blood
Yeah,
sugar balance doesn't matter until you have diabetes, right? Like, going for a walk every day doesn't matter until you've had a heart attack, right? It's like, we're just like programmed to be like, don't worry.
we're more, yeah, like we've gotten really reactive instead of
Pro.
proactive. And so the more things that you can do starting now and just do them every day, it's going to help you so much. And I think it's hard because, yeah, if you're doing this, you're preventing a lot of things from happening. So it's like, this is working, is this not? I don't know. I promise you it's working to get outside, to walk, to eat your vegetables, to
Get
eat
good sleep.
protein at dinner. I promise all of these things are
Yeah.
working.
Mhm. Yeah. And then obviously, when you've done those things, you've made the lifestyle interventions, there's other things that kind of can help as an additional tool to work as a treatment, like medications and other things. So, metformin, it's obviously a widely known diabetes medication that's being studied for its potential, neuroprotective benefits because of insulin, its role in insulin. Intranasal insulin therapy, which is like I know a lot of type ones know about it, but it's like basically like a mist, like a nasal mist that's insulin that's being investigated to show like its improvements. And then anti-inflammatory medications can help target it, which is why I think the GLP-1s are being researched so much because they do lower inflammation and we have GLP-1 receptors in the brain. So I think it's like really reducing localized inflammation. Obviously, I'm not a neurodegenerative disease researcher, but you can look up what they're doing.
Yeah.
I think it's fascinating.
Yeah.
I think I'm too overwhelmed. Like I would be like, we need to know everything right now.
Hmm.
Being able to work in research, you have to be very patient, and I am not.
I will read things, but I do not enjoy doing my own research on things.
Unless I'm
I
like,
like,
into it, like insulin, like
yeah,
I'll do it.
yeah. I'll read other people's research and we'll go from there.
Yeah.
But overall, I will say, well, I guess just a summary of all of it. Type 3 diabetes is not an official medical diagnosis. So don't go to your doctor and be like, oh my gosh, you diagnosed me with type 3 diabetes. No,
They're
it's not an
like,
official medical diagnosis. And really, the medical community is still debating whether it should be separate or treated as a complication of type 2 diabetes. So lots of research still needs to be done. But basically, this kind of just refers to the connection between insulin resistance in the brain and Alzheimer's disease.
yeah.
Type 2 diabetes, a poor diet, and lifestyle choices really do increase your risk of developing this condition. Whether it's a medical diagnosis or not, it does increase the risk of developing insulin resistance in the brain.
Hmm.
So, like I mentioned, there are things you can do: blood sugar balance, move, sleep, decrease your inflammation, really practice your brain health. All these things will help to take care of your brain a little bit better.
Hmm. Exactly. Diet and movement really make a big impact. Like you could bring up any study about chronic disease, and every single one of them will be like, lifestyle. This, along with lifestyle changes, is the biggest
Yes.
impact. And like everyone gets really focused on like, ooh, what is that? Like medication. And everyone's like, just, oh yeah, like lifestyle. Lifestyle
I
change
know I should
or
eat
whatever.
healthy,
Yeah.
but
Okay, I'm doing that.
oh,
Okay, what? Like, give me the good stuff. Give me the overnight shipping option. That's
yeah,
what we're looking for.
it takes time. It takes time to get your body reset, unfortunately. Like I said, if I had a drink I can make you guys, you'd probably buy it.
Absolutely. We could, I mean, there's probably somebody out there that's starting to sell like Fountain of Youth drink and people will buy it.
Yeah,
They will.
whatever we can do to feel younger.
And that does not involve doing the things.
Yes. So we got to do better. And that's why we're here to help you. We're here to make it easy, make it understandable, make it digestible so you're
Yeah.
not so overwhelmed.
Mhm.
That wasn't meant to be like a slap in the face. It's meant to be like you're not alone in that boat.
Right. You're not alone in that boat. And I like to really empower people. Like what you do makes a huge difference. Like you have your health in your
You
hands.
have a lot of control. Yes.
Yeah. I mean, not all of it, but a giant amount of it. You really do. And so like that should feel good. Like I can do
Mhm.
all these things. I'm not destined to, age in this way type thing. But yeah, so definitely not a slap in the face. And if you are having a hard time implementing, lifestyle changes, this is where working with someone like Bailey and I, or another professional, is helpful because we can help break it down. That's what we're doing. So if you need help, get it.
Yes. All right, everyone. Thank you for listening to this week's episode, and we will be back next week. Talk to you soon. Bye.
Bye.